Hello, I'm Andrew Shore from Patient Power. This program is sponsored by Banner MD Anderson Cancer Center. We want to talk to you about colon cancer, colorectal cancer it's often called. You know, most of the time it is preventable. And to help us understand what can be done to prevent it, our guest is Dr. Tom Dragovich. He is the Medical Oncology Hematology Section Chief at Banner MD Anderson Cancer Center. Doctor, thank you so much for being with us.
Andrew, you're welcome. It's a pleasure to share some information with you about this important topic. As you brought it up, colon cancer, colorectal cancer is a very preventable disease and curable disease when detected early. And the impact of colon cancer in the United States is huge. 1 in 20 Americans will develop colorectal cancer during their lifetime. And it's about 140,000 cases diagnosed each year, of which about 50,000 die from colon cancer. So it's a huge impact in this country, in this population.
When I think about colon cancer, it's very personal to me because my mother died of it. It was diagnosed late and it spread to her liver, and that led to her demise. On the other hand, my father would have colonoscopy, and I know we'll talk about that, and he would have precancerous polyps snipped out, and he never developed the disease. So, doctor, help us understand how we can prevent colorectal cancer.
Yes, and you know, I'm probably the person who can speak for that, because I do see, unfortunately, patients that come with advanced disease, quite often unresectable and incurable. And the example of your father is certainly a great example, a personal example. As I said, it touches a lot of families in this country. I think this is a perfect timing for this discussion. There have been two important studies that came out in the last 2 months, international studies, that really confirm the notion that we knew all along for many years, that screening for colon cancer saves lives. You know, there was always that sense that we're saving lives, but really there were no studies that absolutely prove that. Now there are studies that prove that. To your point, when to start, who has a higher risk, it gets a little more complicated. I think the first recommendation is that you should talk to your physician about screening for colon cancer, and also they should be alert to the family history, take a good family history, because that affects how frequently and how frequently and how intensely you will need to be screened in order to save that life. New United States guidelines, United States Preventive Task Force advocates starting colorectal cancer screening at the age of 50 for general population. And then for those individuals who have a strong family history, who are considered high risk, or have a family history of early onset colon cancer, 10 years before the first diagnosis in the youngest family member, or starting at the age of 40. Again, these are very general guidelines. I think it's very important that you discuss with the physician the family history, other risk factors that may influence how early and how often do you get screened.
Think about my family just a little more. I recall that my grandfather also had colorectal cancer. So help us understand the modalities that are used when we talk about screening.
Well, Andrew, I think any screening diagnostic test is better than no screening. I really want that to be clear. Because we know that you know, there are different options, and sometimes they depend on the patient age, other risk factors, comorbidities, and so on. But that doesn't mean that you should not be screened. You know, your physician should certainly advise you on what is the optimal way of screening for you. I would say that the golden standard is colonoscopy. because in addition to actually surveying the colon for presence of malignancies, also allows a physician gastroenterologist to remove any precancerous lesions such as colon polyp. And the study that I just referred to, which looked at a large number of patients in the US that had propensity to develop polyps in the colon, showed that those patients who had regular colonoscopies, when the polyps were removed, actually had about 50% reduction in risk of dying of colon cancer as opposed to the general population. So I think this is certainly bringing up the importance of screening and colonoscopy. Now, it may be that colonoscopy could be something that might be difficult in a certain patients, in certain population, in certain regions, the access to the physicians with expertise. But in that case, I think stool testing for blood and what's called flexible sigmoidoscopy, which is really a partial colonoscopy which requires no full bowel preparation, could be considered as effective screening methods.
Now, anyone who's had colonoscopy, including myself, wonder about the preparation for it. Has that gotten any easier?
Well, I have to tell you that is really the preparation is what most of the patients really kind of are fearful of. Although after you talk to many of my patients, after I talk to them, they say, you know, really it wasn't a big deal at all. It's a quite quick and simple procedure. There are some improvements in that setting. There are certainly different options in terms of preparing patients for colonoscopy and bowel cleaning techniques, and I think those options are offered to patients. Depends sometimes on their individual preference or physician preference. There is a lot of hype about what's called a virtual colonoscopy or CT colonography, which is a new technology. It employs actually not a endoscope but a CT scan. However, that does not remove the need for bowel preparation. I think patients need to be aware of that. But it could be used in some cases where colonoscopy may be difficult to do when patients are older, in which case, again, if there is any suspicious lesion, they will have to have a full colonoscopy or sigmoidoscopy after that. Where the improvements will come, I think, in the near future is there is a series of tests that are looking at the DNA and the genes in the stool sample with an idea of identifying those that are indicative of the present colon cancer or precancerous lesions such as polyps. So I think those will be probably new generation of tests that will obviously not require bowel preparation and cleaning and would be used as a sort of a large spectrum screening test that then could be followed with colonoscopy in those selected cases.
So it seems the bottom line is, with proper colon cancer screening, it can be life-saving, certainly with colonoscopy.
It is life-saving, and I think it is still a golden standard when it comes to the screening technology.
So I know from my own experience with colonoscopy, if they find something, they can snip it out and you come back at some interval, maybe 5 years, but it's not a big deal when you think of how life-saving it can be.
That's right. That's absolutely right. The need for follow-up exams is based on the individual risk assessment and the findings on initial baseline colonoscopy. And I also think another thing that you will be hearing more in next hopefully a few years is there will be some other options in terms of reducing the risk of colon cancer by chemopreventive treatments. There have been a lot of attempts, and there are ongoing trials with different medications that are usually non-toxic and orally available to see if we can actually further improve that or decrease the risk of colon cancer, especially in high-risk population, people that have hereditary non-polyposis, Collie syndrome, Lynch syndrome, or familial polyposis, or just have a very strong family history.
All this information is so good to know, basically, that with the proper screening, in the vast majority of cases, colorectal cancer can be prevented. Thank you so much, Dr. Tom Dragovich, Section Chief for Medical Oncology and Hematology at Banner MD Anderson Cancer Center.
Thank you, Andrew. And just again, a last word is, this is a very important mission to raise awareness about colorectal screening. Unfortunately, despite all of the availability, it's only about 60% of the U.S. eligible population that get screened for colon cancer today.
All right, put this on your list. You heard the recommendations and have the proper screening. It can be life-saving. Thanks for joining us. I'm Andrew Shore from Patient Power. Remember, knowledge can be the best medicine of all.